All right, today we're going to pick up where we left off last time, where we were talking about image weighting and contrast. And as a reminder, we discussed the difference between image contrast and image weighting, and we defined those. And image contrast was no different than how we describe it in X-ray. It's really the difference between black and white on an image. But image weighting, you'll start to hear, and you'll see a capital W behind a lot of these sequences. And that's really how we manipulate the sequence parameters that determines our image weighting. So we also talked about these parameters a little bit in more detail. And we discussed intrinsic contrast parameters and extrinsic contrast parameters. So which ones can you manipulate and which ones can you not?
Extrinsic. You can manipulate. Intrinsic, you cannot.
Good. So intrinsic you cannot. So those are inherent to the body's tissues. And some examples were T1 recovery, T2 decay, proton density are also called spin density, flow of CSF and of blood, and then the apparent diffusion coefficient. So how quickly or slowly or sometimes even restricted water diffuses throughout those molecules. But our extrinsic parameters were things that we can manipulate as an MR technologist, and they are on our console. And those are things like repetition time, echo time, our flip angle, inversion time, turbo factor, are also called echo train length, and our B value, which is associated with diffusion. So we obtain contrast through three things: T1 recovery, which is also called spin lattice. We're talking about how we're losing energy, our hydrogen spins are losing energy to its surrounding environment. And then T2 decay, which is also called spin-spin, so we're losing energy to our neighboring spin. And the T1 and T2 relaxation depend on these three things, and we discussed those: the inherent energy of the tissue, how closely packed the molecules are, and the matching of the Larmor frequency. But then our third way we obtain contrast is through proton density. And once again, that's also called spin density, and that's really just the number of hydrogen protons per unit volume, and that is a voxel of that tissue. So we have a good image here that kind of shows you the difference between a low and high proton density area, and then how they would look on the image. So the low area would have a lower number of hydrogen spins in that voxel, so then it wouldn't create a higher signal intensity. But if we had a high number of hydrogen spins within that voxel, it does create a high signal intensity on our MR image. So we really discussed two tissue types, fat and water, because they are on the opposite end of the spectrums. And you can see why, because fat is a very large molecule with a slow tumbling rate, and the hydrogen protons are not as willing to give up their electrons compared to water, where in water it's a very small molecule, and the oxygen kind of takes those electrons away from the hydrogen, and it becomes polarized. So it's now more susceptible to that strong magnetic field. So it actually has a little bit different precession rate than fat. So we discussed all these things, and then we got to our curves. And how we describe T1 recovery, it's also referred to as spin lattice relaxation. And due to its properties, fat recovers a lot quicker than water. And what we're talking about here, our y-axis was our longitudinal plane, our longitudinal magnetization, and our x-axis was just time. And what was the time in? What was the units? Milliseconds, because it's happening very, very fast. Okay? So the moment we turn off our RF pulse, these tissues start to recover along the longitudinal plane, and fat recovers quicker than water. And what was that arbitrary percentage where we consider tissues fully recovered? 63%, right? Because we don't want to sample the signal right when we turn off the RF pulse, because all these tissues have the same contrast, we allow them to relax a little bit, but we don't want to wait until they fully recover to 100%, because then there would be no contrast between these tissues. So 63% is an arbitrary number, but it also kind of really highlights the difference between all these tissues. So just remember, we have two main tissues right here, but we have all the other tissues as well that we could draw in if we needed to. Okay, so we defined T1. We had several other diagrams to show it. We talked about the T1 times for fat and water. And then we started to get into T2 decay. And when we're talking about T2 decay in our curve, the y-axis is no longer the longitudinal plane. It's the transverse magnetization or transverse plane. And our x-axis is still time in milliseconds. So when we turn an RF pulse on, we flip all that net magnetic vector into that transverse plane. It's at 100%. But once we turn that off, our spins start to decay. And remember, free induction decay, that term that we came to know from the first unit, what's happening in free induction decay is those neighboring spins are starting to go out of phase with each other. Okay, they're at a different point along that precessional path, and so they're going out of phase, so they rapidly decay. And due to its properties, fat and water decay at different rates, and fat decays a lot quicker than water. And the main reason is water was further spaced apart in terms of its neighboring spins, so it wasn't giving off energy to its neighboring spins as quickly as fat was. So what was the arbitrary percentage mark on this curve? 37. But we could describe it in a couple ways. Remember, we could say that a tissue is considered fully decayed, once it has decayed by 63%, or if there's 37% remaining. Okay, so just remember how you phrase that, because the registry will constantly try and trip you up with those two numbers. Okay, so fat and water, and this shows just how those spins start to decay. Fat decays quicker than water. We got our T2 times of fat and water, and then we're about right here. All right. So with this T1 contrast, yes, sure.
And you can't see the screen.
Okay. All right. So we're right here. So when we get T1 contrast, so we have contrast between these tissues, and when we're talking about T1, fat recovered along the longitudinal plane a lot quicker than water. So that vector of fat was larger in this longitudinal plane than water was. So when that next RF pulse hits, fat is going to have a larger vector in the transverse plane than water will. And so an image looks like this when it has T1 contrast, where fat, as you can see here, the subcutaneous fat is very bright, and then the water here in the ventricle is dark. Lateral ventricle, and that's wet tissue. It's not water specifically. It's CSF. So it's CSF.
So you said that fat has a larger vector.
Yeah, so fat has a larger vector as it recovers quicker in the longitudinal plane than water does. Okay, because water takes a little bit longer because it's not giving off energy to its surrounding environment as quickly. And remember, we keep talking about the longitudinal plane for T1 and T1 recovery, but we only get signal in the transverse plane. So we have to hit it with another RF pulse to get this larger vector now into the transverse plane compared to a smaller vector of water in the transverse plane. So yes, fat does have a larger vector when we're talking about T1. All right, and then when we talk about T2 contrast, the transverse component of fat decays faster than water. And that's because fat was a very large molecule. It was packed very tightly together, so it was giving off energy to its neighboring spins very quickly. So those spins were going out of phase very, very fast. So that's what's happening here. So all those fat vectors are in phase with each other. When you turn on that RF pulse, remember that was one of the rules of resonance. They go in phase with each other. But the moment you turn off that RF pulse, they start to dephase and fan out. And fat, just because it's a closely packed molecule, will fan out quicker and dephase quicker than water. So this is what it's showing, is it starts to fan out a little bit slower for water than fat. Okay. So if we sample these two tissues at various points, and we could say, let's go a little bit further down here. At whatever time this is, we can say this is like 5 milliseconds. You can see that water has a higher component of transverse magnetization than fat. Okay, so what do you think is going to happen on a T2 image, T2 contrast image? What's going to be brighter than the other?
Water.
Water is going to be now brighter than fat. Okay, so good. So that's what happens. Okay, so there's a kind of a big issue with this, because can you find the subcutaneous fat? It's right here. It's still bright. So this is where it confuses some students. And the reason it's still bright is a concept we'll learn a little bit later on. It's called J coupling, where we apply repeated RF pulses, and it bumps up the signal from fat with that particular pulse sequence. It's called a fast spin echo pulse sequence. So most T2 weighted images are fast spin echo pulse sequences. But if it wasn't a fast spin echo, if it was just a normal spin echo pulse sequence, this subcutaneous fat would be a little bit darker. But if you had to compare it to the CSF that is in the ventricles, it's not as bright. Okay? So what I tell the students, when you're trying to identify T1 versus T2, never go to the fat first. Always go to the fluid. Find the fluid on every image, and if it's bright or dark or grayish, you'll be able to determine what type of weighting it is. And we'll get to weighting here in a little bit. But thus far, with this T2 contrast, just remember, water decays a lot slower than fat, so it will appear brighter on a T2 image. So let's just, once again, identify where those areas of water are in the ventricles, the lateral ventricles. You also have them kind of right here in the grooves of the brain, as it surrounds the entire brain. This right here is subcutaneous fat. It is still bright. But once again, that's due to what we call a concept called J coupling, but we'll get to that. But just remember, this is not as bright as our CSF. All right. And then the other type of contrast is proton density, also called spin density. And that's the number of hydrogen protons present in a volume of tissue. So our hydrogen spins are present in all tissues, but our proton density and how it appears on an image will be dependent on the patient and the area being examined. So the example I gave earlier, if you're imaging the brain, all those structures typically have a high content of hydrogen spins. But if you're imaging the lungs is just mostly air. Okay? So you have interstitial lung markings and things like that, but those are just such fine little structures. They're not very big. So that's going to appear dark on your image. But when you're imaging the brain, you're going to have all different types of structures, and they're going to have all different types of shades of gray. But just remember, if it has a low amount of hydrogen spins in that unit of volume or voxel, it's going to appear dark on a proton density image. And if you have a high number of hydrogen spins in a voxel, it's going to appear bright. So, with that being said, look at how our water, or CSF, looks on this image. It's gray. We're kind of in between a T1 and a T2. But what's great about proton density is they really differentiate the difference between white and gray matter of the brain. So these were used for a very long time, for years, before a sequence came along called a flare, and we don't use proton density in the brain sequence anymore. It's just really used for MSK imaging these days. But between the white and the gray matter, which do you think has more hydrogen spins in it from this image? The white or the gray matter?
White.
Okay, so the white matter is the one near the ventricles. Is that darker or brighter, though? So that's kind of a trick question, right? Because you'd think white matter is going to be white, brighter, but it's actually reverse. So white matter actually has less hydrogen spins because they actually have like these things called white matter tracks usually kind of in those areas. But the gray matter actually has more hydrogen spins. But once again, proton density, I call it a grayscale image because a lot of the tissues are kind of just intermediate. And the fluid specifically has a grayish tint to it. All right. So we really discussed a lot about image contrast in these previous slides. Now we're going to work our way to image weighting and how we as technologists manipulate some of these parameters to get the desired image weighting. And we had all those extrinsic parameters, but the main ones we're going to discuss for this particular unit is TR and TE. So really highlight TR and TE back on that original slide of extrinsic parameters because those are really the only two parameters you need to adjust to get three different types of image weighting. Okay? We'll discuss that here. So let's review. So remember, fat has short T1 and T2 times. So it recovers very quickly, that's what the T1 means, and it decays very quickly due to its properties. Gives off energy to the lattice very fast, gives off energy to the neighboring spins very fast. Water is the opposite. It has longer T1 and T2 times, so it gives off energy to the lattice or surrounding environment a lot slower, less efficient energy exchange, and gives off energy to the neighboring spins a lot slower because it's a free-flowing molecule. Remember, we talked about vectors, but for high signal, we need a large vector in the transverse plane. Lower signal comes from a smaller vector in the transverse plane. Now, when we talk about contrast, and if we manipulated the parameters, we get a T1 weighted, T2 weighted, and a proton density weighted image. And if we get that desired weighting, what's going to happen, what it's going to look like is, for T1, fat is going to be bright. Water is going to be dark, or CSF. For a T2 weighted image, water is going to be bright, CSF. Fat is going to be a little darker. It's not as dark as you would expect it to look. But just put off in the parentheses due to J coupling. And most T2 weighted images are fast spin echoes. And then proton density, areas of high proton density, it's going to be bright. Areas of low proton density is going to be dark. T1 and T2 relaxation times are inherent to the tissue and are dependent on field strength. So remember, that's one of those intrinsic contrast parameters. Every tissue has a specific curve, recovery and decay. We cannot change that. We can manipulate the parameters to kind of highlight certain tissues, but we ultimately cannot change the relaxation times. And remember, those milliseconds that I'm giving you, they're in terms of field strength. And what field strength are you going to need to know for this test? What Tesla? 1 Tesla. Just 1 Tesla. Not 1.5, not 3 Tesla. You only need to know the T1 and T2 relaxation times for 1 Tesla. Okay. By this point, you should know the difference between image contrast and image weighting. But what's cool is that T1 recovery, T2 decay, and proton density are in every image. Every MRI image incorporates these 3 things. And that's because these are intrinsic parameters. But what we do as technologists and how we manipulate the parameters gives us our desired image weighting. Okay? So that's what I'm saying here. Proton density, T1 and T2 mechanisms are present in all MR images to some degree. But we weight the image where we weigh, and this is where it gets its term, weigh towards one parameter, and you kind of avoid other parameters. So when that happens, when we kind of steer clear of certain parameters, we diminish other mechanisms to create images of a particular weighting. And for T1, T2, and proton density, this is accomplished through manipulation of just 2 extrinsic parameters: repetition time and echo time. And when it comes to PD, proton density weighted images, you actually have to downplay the effects of T1 and T2, right? Because all we're concerned about is the spin density within certain voxels. So now we have to just downplay T1 and T2. And how we do that is by selecting a long TR, which will allow all those vectors to fully recover, and a very short TE to not allow those vectors to decay. We kind of sample at the very start of our pulse sequence. So we have a very short echo time. That won't give a sufficient amount of time for fat and water to decay and separate out, to have contrast. So this is what it looks like. So remember, for proton density, we are trying to diminish T1 and T2 contrast on our image. Okay? And how we do that is by selecting a very short echo time. And just remember, TE is always going to be associated with what curve? What do you think? It is here, but what curve is this? This curve? This is the T2 decay curve. So if it's going down, think T2 decay. So this is our T2 decay curve. Okay? And is that spin, spin, or spin lattice? Spin, spin. Okay? So we select a very short TE because look at how fat and water, they haven't had time to separate yet. So we're not going to get T2 contrast if we select a very short T. Over here, remember, these curves are happening at the same time, but they're two separate processes. You need to remember that. And this curve is what? T1 recovery. Because our curves are going back up. What's the other name for it? Semi. Right? So we don't want to select a very, even though the tissues haven't had time to separate at this point, we don't want to select a very short TR because we'll get zero signal from any tissue. So it will be kind of a pointless thing. We actually allow these two tissues to fully recover, and that will diminish our T1 contrast on our image. Okay? So we've now effectively diminished T2 contrast and T1 contrast. And remember, there was only 3 ways to get contrast in MRI, either T1, T2, or proton density. So if we diminish those two things, all we have left is proton density weighting. And what that is based on just how many hydrogen spins we have in those voxels. Okay? So that's how we get a proton density weighted image. Yes, Fawad?
So what exactly is echo? Is it just the time, the rate at which our pulse is applied?
No, and we're going to get to this in pulse sequences, but echo time is when we're collecting the echo, which is the signal that is coming off of the patient. Yeah. So it's always associated with the transverse plane because remember, that's where our receiving coil is. So we'll get to it, but that's the time we're receiving the echo. And ultimately, what echo stands for is just that signal strength coming from that coil.
From the patient, not to the patient.
From the patient, not to the patient. So don't get that confused with that transmit RF pulse that we're applying to the patient. The transmit RF pulse is designed to just flip that vector into the transverse plane, but then we allow the tissues to start to recover and decay, and we collect the signal from them at a various point. Because remember, we have to let those tissues decay and recover to get contrast, or else they'll all look the same. Good. So does everybody get proton density weighting? We're diminishing what?
Both T1 and T2.
Both T1 and T2. And all we're focusing on is how many hydrogen spins we have per voxel. All right, T1 weighted images. This is dependent on T1 recovery, differences between all tissues, but once again, we're going to focus on fat and water. TR, repetition time, controls how much T1 recovery is allowed to occur. So by keeping TR short enough, we will prevent full recovery of all the vectors. So this will allow us to see the difference in their signal. So we're going to highlight T1 contrast. Okay, we're not going to diminish it because this is a T1 weighted image. So we need to highlight the contrast on a T1 recovery curve. Okay. So how we do that? So once again, we're going to keep that TE short because remember, we want to diminish. We want to diminish T2. Okay? We want to diminish T2 contrast. So we keep a short TE. Those tissues at that point, see how they're very similar in signal intensity. But here, now it's a little bit different. We don't wait for all the tissues to fully recover like in a proton density. We select a shorter TR. See how our TR is shifted to the left? And remember, this is milliseconds. This axis right here is in time. So for the proton density, we allow those tissues to fully recover. And let's say that was like 15 milliseconds. But here, our TR is now shifted over to the left, and our time is a lot shorter. Let's say it's 5 milliseconds. So it's quicker. Okay? And look at the difference between the tissues now. So they're going to be two completely different shades of gray, or bright or dark, on your image. And remember, that corresponds to how quickly those vectors recover up that longitudinal axis. But do we still need to apply one more RF pulse to get signal from those vectors? Yes. Okay, so that's where it gets a little confusing for people when we talk about T1 and T2. T2, you're already on that transverse plane, and you're really just collecting the signal from those vectors as they decay. With T1, those vectors are going up, realigning with the longitudinal plane, but they're realigning at different rates. And when they start to separate, hit it with another pulse, and they're now at different lengths. Okay?
How do you determine the TR? Like, is there like an exact time that you would do? Is there like an equation, or how do you, like, does it differ with every patient?
It's based on the relaxation rates of those tissues. So you have a way of kind of seeing what the relaxation rates are at different field strengths, and we have the data for that. Mm-hmm. So we can determine, okay, fat, it recovers very quickly, and it's in that range of 100 to 200 milliseconds for a 1 Tesla. Okay, so if we're trying to highlight that tissue, we need to set a TR that's very short. Okay, but we have ranges in clinic, and you'll see, like, never go outside of 300 to 700 for a T1. Never go outside of, for a T2, 3,000 to, you'll see your TR ranges for certain scanners. Okay. Because, yeah, you are trying to highlight fat, but you also want to highlight other structures. So you don't do it at, like, 100. You kind of have a range. But, yeah, that's a good question. But it really is just kind of the physicists kind of researching what these relaxation rates are at various...
And that's all, like, programmed into the computer.
And that's all programmed into the computer already. All right. So here we have, once again, the relaxation rates of various tissues. And we don't have fat on this curve, but we could draw it in. It actually even recovers faster than our white and gray matter. So if we pointed to these structures, since fat recovered the fastest, it's bright. White matter recovers next fastest. So you can see how the white matter looks a little brighter than our gray matter right out here. And then our CSF is dark, so it recovers the slowest. Right. All right, moving on to T2 weighting. So T2 weighting is dependent on the difference of T2 decay times between fat and water, and TE, our echo time, controls the amount of T2 decay. So T2 decay, once again, is controlled by TE, and that is allowing a certain amount of time before we actually sample the signal. And since fat and water decay at different rates, this will create contrast on our image. So we have a T2 weighted image here and a pathology right here, an edema associated with it. But let's talk about it. Okay, so we want to diminish T1, right? So how do we do that? Just like before with our proton density weighting and, just like our proton density weighting. So we're going to select a long TR, so we allow those tissues to fully recover, and they're at 100% so that there's no T1 contrast on our image. Okay? But remember, with that proton density, we selected a very short TE, and there was no contrast between the two tissues here. So we're going to smooth our TE over, and it's now longer. So our TE is now longer than what it was for a proton density. And look at how it highlights the difference between these tissues now. Right? So you can see at that specific time, we have two completely different vectors in terms of length and in terms of signal intensity. So when you're looking at an image here, you can see just based off these structures right here. So we have CSF, that's water, and it decays the slowest. So it's going to have a larger vector for longer, if you want to think of it that way. It's going to have a larger vector in the transverse plane for longer. So then we can point to that right there in the ventricles. It's bright. Gray matter decays a little bit slower than white matter, so let's go to gray matter. And that's right here. It's a little bit brighter than our white matter, which is a little bit darker. It's close to the ventricles. Okay? And fat does obviously decay the fastest. And in this situation, maybe they use just a traditional spin echo pulse sequence. Look how it's dark. But what I'm probably suspecting, this is actually what we call a fat saturated image. And this is still a fast spin echo, but they just saturated fat. But this kind of corresponds to what the curves actually look like. Okay. All right. So as a summary, TR controls T1 weighting, TE controls T2 weighting. So always make that relationship. TR controls T1, TE controls T2. So with that being said, this kind of goes along with Savannah's question. It's like, yeah, it's based, you're kind of trying to highlight certain tissues, but there's always a range depending on the field strength and the scanner that you're working on. So for a T1 weighted image, we select a short TR to highlight, so put off to the side, to highlight T1 contrast. So start putting these off to the side, and I'll put them with it. To highlight T1 contrast. Okay. We select a short TE. What do you think? To highlight or diminish T2? Diminish. How do you spell that?
It's DI. IN. ISH.
Is that it? Diminish.
It's DE. Yeah. Well, it's not. It's DI. Oh, no, I know. We also.
This is recorded, guys.
I
was just testing you. I knew this the entire time. All right. All right, now with T2 weighting, we select a long TR to highlight or diminish T1.
Diminish.
Okay. Okay. And then we select a long TE to highlight or diminish T2. It's T2 weighting.
Highlight.
Highlight. And then for proton density, we're not concerned about T1 or T2 contrast, so we're diminishing both by selecting a long TR and a short TE. So I'm just going to put diminish, diminish. Great. But I have two images here. Can you name the weighting? With that being said, can you name the weighting? What do you think? Go to the fluid. Go to the fluid. What do you think A is? T1 or T2? Do we have fluid in the globes of our eyes? Okay. What color is that? Bright or dark? Bright. So T1 or T2? T2. Good. And we have some kind of pathology right here in the temporal lobe. It's probably the same patient here. And then fluid in the ventricles, is that bright or dark? Dark. Okay. Well, it's dark completely. I mean, it's not gray. Let's put it that way. It might look gray, but it's not completely black. Yeah, I agree with that, but it is dark in the realm of MRI images. So that is a T1. T1.
So first one is T1.
T2 up top, T1 down below.
Oh, okay.
And this is actually a T1 with contrast because the pathology is lighting up too. We'll get to that. It's not. All right. So once again, you have to identify images on your little quiz this weekend. And the only choices you're going to get, T1, T2, and proton density. T1, T2, proton density. Okay, so the easiest way to identify a T1 weighted image is to look for fluid-filled spaces in the body. So some examples, CSF. Fluid in the abdomen, might be even the gallbladder, might be in the biliary tract. You might have urine in the bladder. MSK, fluid in the joint spaces. MSK is a little bit harder, and I'll give you a tip to kind of identify the difference between a T1 and a T2 for MSK, and it's really just looking at the muscle next. So fluids normally appear dark on T1 weighted images, but if you inject contrast, like you do here, so here's a non-contrast T1, and here's a contrast-enhanced T1. Blood vessels will appear bright, and typically a lot of pathologies are vascular fed. So, but look here, these are normal blood vessels. You've got your venous structures here. You've got more vessels covering the brain here. You have your choroid plexus within the ventricles. And then you do have a vascular-fed pathology. So this is a T1 with contrast. Okay? But just go off once again, the ventricles are dark. And another way to double check is, oh yeah, fat. Fat's bright on a T1. So our subcutaneous fat is also bright. Going over here, yeah.
In that second image, so the bright that's showing is actually the contrast.
This is the contrast. Because look right here. This is what it looks like pre-contrast, and this is now contrast. And that's why contrast is so great, because look, it's hard to see that pathology without the contrast enhancement, and then now we can see it more definitively. And we can kind of see the edges of whatever pathology that is, probably a tumor. All right, and then we have a sagittal spine. Okay. So once again, go to the fluid-filled spaces, and the only fluid-filled space we have here is our CSF that surrounds the spinal cord. So we might have to zoom in a little bit, but the spinal cord right here ends at the conus medullaris around T12, L1, But then the rest is just CSF filled. But the CSF does surround the spinal cord, and it's dark. So that's another way that we can identify that it is a T1. And then to confirm, the fat is bright, so it's our T1 weighted. But on the registry, it's going to get tricky because they might add fat saturation in. It might be pre and post contrast. I won't do that to you for this unit. So just make sure you can identify it.
I might have missed this, but the fat sat, then the adipose tissue appears dark. Can you explain that? So I thought fat appeared bright.
Yes, yes. So this is not fat satted.
Okay, but
none of these images are fat satted.
But the bullet at the bottom that says fat sat adipose tissue appears dark. So is that like a different? That's like
problem? So yeah. You'll see on the weighting. So we'll see T1 weighted. It'll have T1 and a W, and then you'll have an FS behind it because it's now fat saturated.
Okay.
And it's designed to saturate the fat so that you can see like a lesion easier. Okay. So some sequences are fat satted, and the adipose tissue will be dark. So none of these sequences right here are fat satted. So the adipose tissue is not dark yet.
Okay.
But that's another RF pulse we have to add specifically to saturate fat. But that's when we start to talk about pulse sequences.
Okay.
We'll get to that. All right, here's our T2 weighted images. So we have axial spine, axial brains, and then a knee, axial knee here. So once again, go to the fluid-filled spaces, and that it's actually even more important here because remember, fat is also bright on a T2 due to J coupling and it being a FESP and echo. Make sure you go to the fluid. So on this axial L spine, we have the spinal canal. We have CSF there, and then, yeah, you have some of the cauda equina within that, the nerve fibers of the spinal cord. You could also look at fluid within the abdomen. We don't have an abdomen image here, but think about the bladder. Synovial fluid within the joints. So you got synovial fluid in the knee joint. That's bright. And then your CSF in your ventricles. And then the globe of your eyes. Vitreous fluid. That's bright as well. So that's how you identify a T2. And then our proton density. Once again, we look at the fluid, and the fluid looks grayish white. So it's not completely bright white, and it's not completely dark. So it is grayish. That's how I kind of describe it. And then you'll definitely be able to identify it for brain because the gray matter, once again, is a little bit brighter than the white matter. And this is what that proton density was really good at. It was really differentiating between these two structures. Here, you have a little synovial fluid that's a little grayish. Our fat is not very bright. Here's a kind of a cool diagram to show you the difference between certain structures and how they look on the image. And just know that certain structures will always be completely black. Hair, cortical bone, tendons and ligaments will always be completely black. So look, we got our quadricep tendon, patella tendon, completely black. Meniscus, completely black. Cortical bone, that kind of outlines the bone on the very periphery of the bone, completely black. Yeah?
So based on what you were saying in the lecture, is it a fair assumption to make when you see MSK and some brain to just jump straight to PD and start looking for it? In a sense, because at the beginning you said PD is supposed to be used for MSK.
Yeah, but it's not the only image weighting that we use for MSK. But I was saying they don't use PD in the brain anymore, but it's not a sequence that we don't use anymore. That's what I was trying to say. We still use it for MSK. Yeah. but we still do T1s and T2s of like a knee as well. Okay. And then here's just another good little breakdown of what these tissues look like. And then, once again, MSK is probably the hardest to identify if it's T1, T2, or even proton density, because you might have just a small amount of fluid within those joint spaces. And yeah, you can see it just because I'm highlighting it here. This is a T2 because the synovial fluid is bright, and this is a T1. But if you just had the T1, you wouldn't know if that's fluid or just some kind of structure around the bone. It's hard to tell. So another way to determine if it's a T1 versus T2 is go to the muscle. And muscle on a T2 is going to appear darker than on a T1. Muscle on a T2 is going to appear darker than muscle on a T1.
Darker?
Yep, muscle will appear darker on a T2 than on a T1. Right? So we'll end this PowerPoint there, but I want you to go to modules, and there's a document here that just says T1 weighted, T2, and proton density weighted images. Click on that. And here are more examples in various planes. So study this document to prepare for the quiz. Okay? So let's go through these images real quick, because we still have a couple minutes here. And just reason why it's that particular weighting. Okay? All right. So our T2 weighting. So in essence, fluid should be bright and fat should be dark, but we know most T2 weighted images, just because they're usually longer sequences, because their TRs are a little bit longer, and we've designed it so that we shorten the time up by doing something called a fast spin echo, and we'll get to it. But with that fast spin echo, it bumps up signal from fat as well, so fat also appears bright. So always, always, always go to the fluid first. I can't stress that enough. Always, always, always go to the fluid. So I find the fluid-filled structures in any picture, if it has any. And in this axial brain, we know that the ventricles are filled with CSF. We have CSF that surrounds the brain. It's bright. T2. Here's my sagittal. Same structures, right? Lateral ventricle, but then you also have CSF that surrounds the midbrain, the cerebellum, and it goes down and surrounds the spinal cord. This is a good mid-sagittal plane of the brain. Okay. We don't have the globes of the eyes to go off of because we're right in the middle of the patient's body. Right? Here's a coronal of the brain. Once again, these lateral ventricles. But we also have the CSF surrounding the brain, going into all the different grooves of the brain. Moving down to the C-spine. Okay, we're starting to get away from the CSF in the ventricles, but we see the CSF surrounding the spinal cord, which is a darker structure. Okay. Moving down to the T-spine, lateral T-spine. CSF, still bright. See how fat is bright, technically, but not as bright as our CSF. We have some kind of pathology here, too, impinging on the spinal cord. We don't know what type of pathology that is yet, but we know it's something there. It's not fluid-filled because it's not bright, so maybe it's some kind of vascular-fed cancer or lesion. Here's our T-spine, but it's in the axial plane. Okay? So once again, this is not fluid. This is fat, kind of in that mediastinum area. It's fat back here. But the fluid is surrounding the spinal cord. The spinal cord, just in this situation, is pushed up to the top because we're laying on our back here. And for some reason, the fluid is kind of accumulated at the base here. But you have CSF fluid that ultimately normally surrounds the spinal cord completely. But the spinal cord can kind of move around in that spinal canal. Okay, so CSF here. Moving down to the L spine, we know our spinal cord ends or terminates the conus medullaris, but you can get into the cauda equina, and that's a darker structure than our CSF that surrounds it. All right, but all this is fat in the abdomen. All this is subcutaneous fat. Here's our axial. Once again, CSF. We got all the nerve roots and fibers of the spinal cord. T2. All right, here we don't have CSF, but we do have, this is a female soft tissue pelvis, but we have urine within the bladder. We have a little bit of fluid in the endometrium of the uterus. Okay. And you can still see a little bit of the fluid kind of in that spinal canal area here. But everything else, that's just either subcutaneous fat or fat within the abdomen cavity. And then the MSK, this is synovial fluid. And so if something happened, a lot of edema, and they have a big old sac of edema from swelling. But that kind of just hints at T2 weighted. But once again, if we didn't have that, we couldn't actually see any synovial fluid in the joint space. Go to the muscle, and the muscle is very dark. Okay? This is all subcutaneous fat. All right, now moving to T1. So in T1 weighting, our fat is bright because it recovers a lot quicker than water. So fat is bright, and CSF is dark. So go to the fluid, dark, it's a T1. Dark, T1. Here's a sagittal. It's hard to tell because you only have a little bit of the posterior horn of that lateral ventricle, but it's dark. And you have the CSF surrounding the brain, and that's dark. But sometimes it gets tricky, and they'll do this on the registry, where they just give you a tiny little sliver of like a structure, and you have to identify the weighting. This is nice because it's mid-sagittal plane, and our CSF is dark, fat is bright. And some T1 weighted images, the fluid's not going to be as dark as you would expect, but that's just how they kind of manipulated their TR. And for some reason, they kept their TR a little bit longer for this sequence, but this is still technically a T1 because CSF is dark and fat is bright. Moving on down the spine, kind of the reverse of what we talked about with the T2, but let's just find those fluid areas around the spinal cord. And this is a C-spine because look at how small these vertebral bodies are. C-spine, and you can see the trachea here as well, so you know it's a C-spine. And then you got your spine, sagittal spines moving on down, but our CSF is dark and our fat is bright, T1. And then here, this is a big old abdomen image. But there's really not that much fluid on this image. There's no bladder that we can look at. There's no gallbladder. There's really not even much of a stomach, but there is food in like the stomach, and in the colon, but that's not fluid. It's food. So you still have to go to the CSF, and it's a very small because we're looking at the abdomen, but it's dark surrounding that spinal cord. Here we have a soft tissue of a male pelvis, so we've got the prostate, but here is that bladder, and it's filled with urine, and it's dark, so it's a T1. And if you didn't know that, or could see the bladder, you could go off the muscle, and it's not as dark as a T2. And then your proton densities. You're getting in your grayscale images. Fluid is grayscale, and then you have really good differentiation between white and gray matter on all three of those brains. And when it comes to proton density, I'm not going to throw in any kind of other image. It's just brains. Because it gets too hard when you're kind of looking at like MSK with proton density. So review this document to study for the quiz that's due Sunday, and use that, start working on that worksheet, and if you have any questions, you could always watch the video as I go through that worksheet. Any questions?